on now to save lives now. First, empower communities. Every individual must understand that they are not helpless. There are things everyone should do to protect themselves and others. Your health is in your hands. That includes physical distancing, hand hygiene, covering coughs, staying home if you feel sick, wearing masks when appropriate, and only sharing information from reliable sources. You may be in low-risk category, but the choices you make could be the difference between life and death for someone else. Second, suppress transmission. Whether countries have no cases, clusters of cases, or community transmission, there are steps all countries can take to suppress the spread of the virus. Ensure that health workers have access to training and personal protective equipment. Improve surveillance to find cases. The single most important intervention for breaking chains of transmission is not necessarily high-tech and can be carried out by a broad range of professionals. It's tracing and quarantine contacts. Many countries actually have used non-health professionals to do contact tracing. Third, save lives. Early identification and clinical care saves lives. Providing oxygen and dexamethasone to people with severe and critical disease saves lives. And paying special attention to high-risk groups, including elderly people in long-term care facilities, saves lives. Japan has done this. It has one of the highest population of elderly people, but its death rate is low. And the reason is what we just said. Many countries can do that. They can save lives. Fourth, accelerate research. We have already learned a lot about this virus, but there is still a lot we don't know, and there are still tools we need. This week, we will convene a second meeting to assess progress on research and development and re-evaluate research priorities for the next stage of the pandemic. And fifth, political leadership. As we have said repeatedly, national unity and global solidarity are essential to implementing a comprehensive strategy to suppress transmission, save lives, and minimize the social and economic impact of the virus. No matter what stage a country is at, these 5 priorities, if acted on consistently and coherently, can turn the tide. WHO will continue to do everything in our power to serve countries with science, solidarity, and solutions. The critical question that all countries will face in the coming months is how to live with this virus. That is the new normal. Many countries have implemented unprecedented measures to suppress transmission and save lives. These measures have been successful in slowing the spread of the virus, but they have not completely stopped it. Some countries are now experiencing a resurgence of cases as they start to reopen their economies and societies. Most people remain susceptible. The virus still has a lot of room to move. We all want this to be over. We all want to get on with our lives. But the hard reality is, this is not even close to being over. Although many countries have made some progress, globally, the pandemic is actually speeding up. We're all in this together, and we're all in this for the long haul. We will need even greater stores of resilience, patience, humility, and generosity in the months ahead. We have already lost so much, but we cannot lose hope. This is a time for renewing our commitment to empowering communities, suppressing transmission, saving lives, accelerating research, and political and moral leadership. But it's also a time for all countries to renew their commitment to universal health coverage at the cornerstone of social and economic development, and to building the safer, fairer, greener, more inclusive world we all want. I thank you.
Thank you, Dr. Tedros, for these opening remarks, marking the 6 months of pandemic. We will now open the floor to questions, reminding once again journalists that if they wish, they can ask questions in 6 UN languages and Portuguese. So if we are ready from the technical side, we will go first to Georgia, Georgian news agency, and we have with us Konstantin Yonatamishvili. If you hear us, Konstantin, please go ahead.
Yes, Konstantin Yonatamishvili, I press Georgia. Thank you very much. My question is, for Georgia as a country with small economy, but at the same time with good results of fighting the coronavirus, what will be the mechanism to get access to the vaccine that will be developed, I hope, with the support of the World Health Organization? Are there any other possibilities to achieve so-called herd immunity besides vaccination? Thank you very much.
Good afternoon. We all hope, as you do, that we can reach a point where a safe and effective vaccine is developed and allocated fairly to countries around the world. As the Director General has said in his speech, we don't have that vaccine yet, and there's a lot we can do now to suppress transmission, and I believe the Republic of Georgia has been doing well in this regard, both in terms of community engagement, in terms of suppression of transmission, in saving lives through adequate clinical care. But yes, we do hope that a vaccine will be developed. There have been over 133 candidates put into the system. A large number are now in clinical trials. The Director General launched the Act